All right, guys. So this is just a few things that are a little bit helpful, just some helpful information that I received from Morgan and Morgan. I am on their mailing list, so they do send these helpful little things out every now and then. So these are several recalls we have now. Of course, Shark Ninja pressure cooker. They've recalled 1.8 million pressure cookers due to burn hazards. Also, the Igloo rolling coolers, those are being recalled due to amputation or crushing or laceration reports. Also, Ford. Now, Ford vehicles usually do have a lot of recalls. Sometimes it's not that big of an issue, but this one here, it says 1 million Ford vehicles are being recalled due to risk of crashing, and this includes Ford Bronco, Ford Escape, the Ford F-Series, so that would be like the F-150, F-250s, whatever, Ford Mustang, Ford Lincoln, and more. I'd recommend that you speak with the person that makes your vehicle repairs, and they should have access to that information so they can tell you whether or not your specific vehicle is a part of that recall list. And then also Tattoo Ink. There's a recall on some tattoo inks due to bacterial contamination. What so some adverse side effects can cause rashes, lesions, and that can lead to permanent scarring. What I will encourage you to do is if you're doing everything that you're supposed to do, like taking care of your tattoo, you've already gotten it, you're taking care of it, you're doing all of the aftercare that you're supposed to do, and you're doing it in the way that you're supposed to. However, you're still noticing some rashes or some leaking or having like excessive amounts of pain or anything like that. What I'd encourage you to do is take yourself to an ER, let the triage nurse at least let one of them look at it and see if it needs, further escalation, see, what the deal is on that. I had a bad tattoo and it ultimately resulted in having to be treated as a burn. And now that's what it looks like. It looks like it's a burn in the shape of my tattoo. So, so I would definitely recommend that as soon as you notice something that appears odd, rashes that you have, regardless of you're taking care of it properly, or any leakage or anything like that appears abnormal, go to an ER, let the triage nurse look at it and go from there. Okay. This is just a little few things that I thought might be helpful. Okay. So I'll talk to you later. Bye.